I would like to call upon Dr. Kuldeep Kumar, Professor and Head of Department of Psychiatry at Safdarjung Hospital, New Delhi, as the chairperson. Mrs. Jha sir to co-chair the session as well. Our next talk is not, we've been talking about aging physically and socially, but we've not talked about how the day we are born, there are changes in our brain that keep happening year after year, day after day and minute after minute. We see senility sets in slowly. There is no number to it, but it sets in with time. Now, our next speaker is an eminent neurologist from Chandigarh. He was in PGI Chandigarh as the professor of neurology, and now is also the president of the Indian Association of Age Management. Please welcome Dr. Suresh Bansal for his talk on the aging brain. Thank you.
So, good afternoon, friends. It's a great pleasure again to have the stalwart speaking on a topic of his choice. Great extensive experience. So may I call upon Dr. Suresh Bansal to make his presentation.
It's my honor also, unique honor, to chair the president. Thank you, sir.
Thank you very much. Thank you, all of you. See, first of all, we are going to talk of the brain, mind, and body. If there is a brain, there is a mind. And if there is no body, there is no use of brain and mind. So, brain and mind, they are reciprocative to the body. See, whatsoever has been talked recently in 3 or 4 lectures, this was touching the social aspect. This was touching the mind also. This was talking about the sensitivities, issues, or the other issues. So I'm going to talk about the aging as far as the brain is concerned. So somehow the people take it, maybe in the countryside, even in the urban areas also, they do not foresee the subtle things which is propping in as far as the aging brain is concerned. They will say, okay, it's all okay. People, in fact, they don't have time nowadays. Isolation in the way we have discussed it. So they don't have time to sit down maybe for half an hour, 1 hour, along with their elders to define what is all happening. Because surely early years in aging brain is going to be very, very useful. May it be domiciliary, this may be palliative, this may be some sort of new treatment which I am going to discuss. So I have been introduced why I have made this graph. Ultimately, we want something sustainable. Whatsoever that topic is going to be there, or the measure is going to be there, it has to prove its worth as far as the long period is concerned. What is important is the vigilance. We have to be alert. We have to be knowing. We have to be aware as far as what is happening inside the brain. For that, we have to know little something about the structure. Because nowadays, by virtue of the availability of the MRI, routine MRI, functional MRI, MRI tractography, and what not. I'll come to it. I'll show to you the videos also. What is happening? Can we check the aging process well in time? Can we take the measures? We can know that the dementia is just coming in. Alzheimer's dementia is just coming in. And with the help of some sort of treatment, we can just check it. We can just make the things recover. I will touch the fancy therapy like stem cell also. But I feel that is more talked rather than done. That's what I was saying, brain, mind, and human body. You see, the brain is, I'll say it is the king, and this is the prime minister. So they work hand in hand. But brain do have other things also to control. Motor control system. Mind it. The motor control system is again under the domain of mind. In case you want to initiate some sort of movement or maybe going transfer, for example, you wanted to come to this conference. So maybe that was your brain. But you just thought of it as far as the mind said it. Okay, what is going to be the use of that? Is it going to be useful? So there is going to be some sort of preoccupation, some sort of emotion there propping in along with the thoughts. So that could not have made you come to this conference. So both the things, they come hand in hand. What happens once the age comes? in aging, brain shrinks. Brain is just like walnut. When at the time of birth, in a normal fetus, it's 700 grams. In the first 5 years, it's 1500 grams. In you and me, it is 1500 grams. I don't know about me, but maybe my brain is getting atrophied. But there is a decreased brain mass, both grey matter as well as white matter. I'll come to it. The aging doesn't affect only the brain. It affects everything. It affects the blood vessel also. So the brain blood flow decreases. Degenerative processive overtakes. You see, regeneration and degeneration are two important processes which starts almost at the time of birth. Regeneration is far more as compared to degeneration is concerned in the early age, maybe 20, 30 years of age. But after that, degeneration process is more as compared to regenerative process. There the memory declines. So I have told you, as far as the brain is concerned, this is the left hemisphere, this is the right hemisphere. So the left hemisphere is concerned with more of neurology, and the right hemisphere is more of concerned with psychology, neuropsychology. See, this is what is responsible for cognition. The cognition will come on this side. So the left hemisphere is responsible for cognitive factors. And what are these cognitive factors? Consciousness. This is one of the very important things. And maybe sometime one of the speakers said about the universal consciousness. I think Dr. Kishore, he talked about this. So this is again a big topic. So now this lies in the whole brain, in the brain stem also, but more on the left side of the brain. As far as the orientation is concerned, again, to time, place, person, and body space, it's all on the left side of the brain, more on the left side of the brain. Memory also, learning. So learning and the memory, it's not the simple memory which you will see in the machines like computer. Very few, you see, we are talking of so many robots and other things and so many other things. See, all these things are memory in and memory out. There are only few robots which is having few emotion which has been filled in that. See, as far as the Hindu Shastras is concerned, there are different type of Akash. One is Bhautik Akash, physical sky. All of us we see. Space is far bigger than the small planets or maybe the Milky Ways or black holes are concerned. But more important is that we have to see the memory in comprehension. Unless we make sense out of something, word. I'll say the word is simply some sort of phonation. The meaning of the word lies in anonyms. If there is no day, there is no night. If there is no good, there is no bad. So these all things are important. As far as the memory is concerned, comprehension is very important. Abstract thinking is again related to the left. Intelligence. So there lies the intellect, which with experience, interaction, and coming over here into this word is converted into intelligence. Intellect to intelligence, and thereafter knowledge. That is experience, personal perceptions and perspective. And both they cause knowledge. And ultimately all mingle together, tied together, this is the wisdom. Again, wisdom is of different type, lies more on the left side compared to the right side. So what is the right brain for? See, this is again very important. You see, that's what the Albert Einstein had it. You know about the Albert Einstein having an IQ of 153. Everyone in America is going to talk about the Albert Einstein and in which way he used to think. His thought used to be not fragmented. It used to be a sentence. That's what the right brain is going to do. And this is related to the cognitive factors. The cognitive factors, the psychiatric factors, are the emotions. So they are thinking process, behavior and emotional things. So attitudes, this is what our tag is. At the end of the day, this is, you can say, name such and such. But name has been given by you guys, the society. So we have some sort of observation, mindset, again the experience and attitude. So this is again related, it all depends on our thoughts, logistics, innovations, positive or negative. Behavior, social quotient. Nowadays these things are more important. In case I'm going to talk of the intelligence quotient, which lies on this side more as compared to the social quotient, which lies more. As far as the emotional quotient is concerned, again which lies more on the right side of the brain. Emotional quotient is far more better as compared to the intelligence quotient, irrespective of the platform whatsoever we are practicing in our life. Taken the social quotient, all these politicians who can cut the ice, they are having very good social quotient. They can speak something of worth. They can convince others. I don't know whether they are having some sort of disorder or not, but the people has worked out that maybe certain gurus or the dignitaries, even Jesus Christ also having some sort of psychiatric problem to you for this. As far as the aging is concerned, in which way this is creating problem. See, this is I used to be involved in the brain cut sections 25 to 30 years before in the pathology department of PGI Chandigarh. There were no MRI, CT scan at that time. And we used to see if there is a cut over here and this is the type of the brain. We can see it non-invasively with the help of the MRI. Simple MRI. Better as far as the soft tissue is concerned, magnetic resonance compared to the computer CT scans. So, what happens with aging? There is a decrease in the brain cell. There is something like 1 trillion brain cells. Each brain cell is having about 1 million connections. So this is something like what is said is the electrical activity which is produced every nanosecond. I am talking to you. Your brain is so much, each and every one's brain is so much dynamic that every nanosecond there are new connections which is being formed. There can be so much generation of electrical activity, something like 200 watt. Bulb can be lit up with the quantum of energy which is there, but that start decreasing with aging. The connections start decreasing. I'll show you the one of the video also just now. There is a reduction in the volume of both gray matter outer side as well as the volume of the white matter, the inside. And there are neurochemical changes also. Can you show me the video? So this video is from the National Institute of Health, Bethesda, Maryland. This will show you the process of degeneration in dementia. How the things settle up. This can be nowadays after are you showing me the? So this is what I'm talking. This is the a small clip. This is a larger clip just to save the time. I have just made a 1 minute clip over here, and you will see what is happening inside the brain.
The human brain is a remarkable organ. Complex chemical and electrical processes take place within our brains that let us speak, move, see, remember, feel emotions, and make decisions. Inside a normal, healthy brain, billions of cells called neurons constantly communicate with one another. They receive messages from each other as electrical charges travel down the axon to the end of the neuron. The electrical charges release chemical messengers called neurotransmitters. The transmitters move across microscopic gaps or synapses between neurons. They bind to receptor sites on the dendrites of the next neuron. This cellular circuitry enables communication within the brain. Healthy neurotransmission is important for the brain to function well. Alzheimer's disease disrupts this intricate interplay. By compromising the ability of neurons to communicate with one another, the disease over time destroys memory and thinking skills. Scientific research has revealed some of the brain changes that take place in Alzheimer's.
Another is the deposition. I'd like to come out of that video. No. There are comprehension challenges as far as the old age is concerned. And this is what happened in the 80 years old image. You can see the MRI of the 80 years old. You can see in which way there is a loss of the gray matter, in which way there is a ballooning of the ventricles. And this is because of the loss of the white matter. This has been just seen in the video. There is a forgetfulness, naming difficulty, comprehension problem, mumbled speech. I'll show you another video for that. There is a low multitasking, ability to follow verbal instruction, increased reaction time. The hand-eye coordination is less. Sensation is decreased. I don't want to elaborate this, but this is again a very, very meaningful data. There is a problem in coordination, body movements, locomotion, transfer. That's why there is a fall. Fall is very important. That can create problems. There can be subdural hematoma, or there can be fractured neck of the femur. That's the balancing and the motor skill that is also affected. There is sleep disturbances. In the advanced stage, sleep-wake cycle changes. A patient classical of Alzheimer's dementia will speak during day and will make others awake during night. As I said, there is a gait abnormality, there is a disability also. What are the challenges ahead? Navigating challenges related to healthcare access, social isolation, financial security, and age-related discrimination. You have listened so much on this. But again, this is also true as far as the brain aging is concerned. Population is increasing. We have definitely, it's a cause of concern. This should be cause of concern. There is a domestic abuse, isolation. This is what the WHO says. This loneliness, I'll say forced loneliness, social isolation. What is this going to cause? 25% increase in the risk of early death, 30% increase in the risk of stroke and cardiovascular diseases, 50% increase in the risk of developing dementia. So they are having, most of them, they are having dependent living, limited finances, emotional dependence. The more affected, the marginalized are the rural area peoples, poor, having less of supportive system, malnourished. They face more violence. There is more morbidity as well as morbidity. How to make the diagnosis? History is one of the very important things. Can I have the video? So I am presenting you one patient who came to me from Himachal Pradesh, Shimla. So you will see again a 1-minute interview with this. In which way these patients present. I have shown you that molecular area, in which way the brain circuitries are going to be affected. See in which way the interview, I am going to interview for 1 minute to this patient from Shimla.
कौन सा शहर है? ये कौन सा शहर है? यहीं का है। नहीं, इस शहर का क्या नाम है? ये शिमला है कि चंडीगढ़ है? हैं? ये कौन है? ये देखो, ये कौन है? ये वो खड़े, कौन है वो? है जी? अच्छा, यहाँ पे बिजली का पंखा कहाँ है? बिजली का पंखा, हाँ, इस कमरे में कहाँ पर है बिजली का पंखा? है? आपका दायां हाथ कौन सा है? दायां हाथ दिखाओ। ये समझते हैं दायां हाथ? भाषा समझते हैं? अच्छा। और आपका कान कहाँ है? बायां कान, बायां कान कहाँ है? कौन से गांव के रहने वाले हो?
So come out of this video. So you have seen that there is no purposeful contact which can be made with this. He is fumbling. He is not sure where he is. There is loss of orientation, place, person. Next. See, these are the patients who are advanced cases, but there are cases who come early also. But most of the time that is taken in a different way as far as the attendants are concerned. Lifestyle. Those patients we have discussed at length, those who are having sedentary life, there is a metabolic syndrome, unhealthy eating, despite of being rich, unhealthy diet, Poor exercise. This is one of the very important things. See, I'm not saying they go for the gyms, go for the aerobics. Simply go for the strolling. And it has been highlighted, 15 minutes strolling is fairly good enough. Psychometric analysis. How we are going to say that there is a memory loss or not? What are the various ways? I was talking with one of the clinical psychologists in UCLA University. Still they are doing with paper and pencil. But there are certain gadgets now available by virtue of which we can do digital psychometric analysis, by which we will be able to know where is the problem. Is this the memory, attention, concentration, reaction time, or is this focused concentration, diversified attention, concentration, executive function. All this can be known with the help of the digital psychometry. We can also know to some extent the depression and the mood. As far as the investigation is concerned, function, EEG, structure, MRI and other things. I'll come to this, and this is what I was talking to begin with. So brain imaging, I will talk about the MRIs and CT scan and the PET scan. Blood test, very important, and CSF examination. You see, this is the normal, this is Alzheimer's disease, this is frontotemporal dementia. Dementia is again of different types. There can be a degenerative dementia, primary neuronal dementia, just like you have heard of Parkinson's disease. In Parkinson's disease, there is a primary neuronal dementia. So primary neuronal dementia can be seen in number of situations. I'm talking of the Alzheimer. I'm talking of basically the aging brain. So in the aging brain, you can see that there can be in the simple MRI, the garden variety, walk-through MRI. This is what we can see. You see the frontal lobe. Frontal lobe possibly is the 50% of our mind. This is what the human are wise. See, this is our frontal lobe. That's why we put some sort of thing to make it cool. So frontal lobe analyze the thing. This is type of dominance which is going to cool our this panic switch. Our panic switch is amygdala, the limbic system. So this is going to help that cool as far as the frontal lobe is concerned. So there can be different type of dementia. I'm talking of the Alzheimer dementia. So in Alzheimer dementia, you have seen it, that there is a deposition of neurofibrillary tangles. It means abnormal neuron. And there is deposition of amyloid tissue. Now why you can see the amyloid tissue. This is the positron emission tomogram MRI. You can see the normal, you can see frontotemporal dementia, but see the Alzheimer, the deposition of that, the amyloid. So this is important. We can reverse this process with the help of the present available therapy. There are different type of therapy which I am going to discuss with you. You see, again, as far as all these things is concerned, of course, we'll say, is there some sort of genetic predisposition in all these Alzheimer dementia or other brain disorders? 20%. Mainly these are the environmental factors, the lifestyle, which is responsible for this sort of disease. And there are, again, it has been highlighted that this is all a teamwork. I'm not going to go into detail of this. What I'm going to talk about is the treatment. So I'm not against or in favor either of allopathy, Ayurveda, mixopathy or homeopathy. Yes, I'm very much concerned as far as delivering the best to the needy, well in time, so that there is a good quality of life as it was highlighted with someone. But why quality? People are concerned with the quantity also. So I'll say both quality and quantity should be pushed in. And this can be done in case we are able to take some sort of measures well in time. Now this portion is showing you the degenerative brain. You can see these are the neurons, these are the axons. They need to have good number of connections. I showed to you. You have seen the video also. And this is after the treatment which is available now. Steps is delaying aging. How we can delay aging? We have known so many things, metabolic factors and regular exercise, the role of diet and the role of lifestyles, emotional factors, comorbidities, and Dr. Jha, I think, talked about the vaccination also. Drugs, allopathy. There are about 4 drugs available. I'll say these drugs are fairly good. My own experience is with the help of the drug, I have, in the last 20 years, made significant improvement up to the tune of 30%. take my words. In case I'm dare to speak that as far as the Alzheimer disease is concerned, I split it into stage 1, 2, 3, 4. Even at stage 3, you have seen that video which to whom I was interviewing. I'll say that is possibly stage 3 Alzheimer dementia. So taking some measures, there can be improvement. At least we want that at this age, they should not be dependable on others. They should be independent as far as the activity of daily living is concerned. Ayurveda, I always give Brahmi and Sank Pushpi. This even the neurologist in the Neurology Society of India as well as Indian Academy of Neurology, they have accepted that this is having a good role, Brahmi and Sank Pushpi. So I make a good mix. You can say I believe in mixopathy. Even indigenous medicine. So there are so many things, the home remedies, which is promoting this thing, microsurgical thing.
I think you are concluding. Please conclude, because
okay.
right, time warning.
Last but one slide. So stem cell and then deep brain stimulation. I don't find much help as far as the stem cell is concerned. Deep brain stimulation is on the way and it is going to come, are available very soon. Monoclonal antibodies. So that's what I said it as far as the aducanumab is concerned. Over here, well in time, as and when there is deposition of the amyloid, this can be given and the progress can be checked. What is the carry home? Now the carry home is realistic target. I have given this shortcut to everyone, so that this one can put in the pocket also. Health, fitness, lifestyle, legality and social culture. Use it or lose it. Very important. Keep using your brain. Play games, cards, crosswords, puzzles, chess, reading. Be proactive. Idle weight, exercise, idle sleep. Check comorbidities. Mental health. Check isolation, plan retirement, social interaction, community living and self-respect. Falls are dangerous, as I said to you. 10 minutes chair exercise. I will not like to elaborate this. Maybe some physiotherapy is going to help it. Communication, very important. Keep talking with co-mates, maybe juniors, seniors. It is better for the children to give at least some time, not only money or good room, but must devote some time to their elders. Healthy diet. Again, I am not going to, people have said it, this can add to that, but it's okay. Domiciliary care, it's very important. Remove the doormats. Present day, we are very fond of good flooring. There should be dim light on at the night. Handle should be there with near the commodes. Stack the sticks, 3 ports, maybe 4 ports, wheelchair, digital phone oximetry, and the injury care kit should be available at hand. There should be BP plates and glucometer. Should be available. I said it earlier also, triggers can be stress. A person who is doing almost good, maybe on the borderline dementia, can be triggered with the stress. Digital intervention, minor brain attacks, low sodium, hypothyroid, some drugs, low blood pressure, bacterial or viral infection and injuries. Small memory loss doesn't mean that we are having dementia. Forgetting name is again, it's not that we are getting into dementia. This is a normal thing, normal aging. Difficulty in complex problem solving, vision, hearing loss, this should be checked well in time. Thank you, and if there is some question.
Right, thank you very much. You have elaborated the brain into left and right, into the anatomy, into the functionality. Well, I have one clarification to know from you, that as you have rightly said, there is atrophy of brain, very commonly written presentation in MRI report, CT report. And all of us do start taking decholesterol medicines. Is there any relationship taking medicines to decrease cholesterol and brain atrophy?
Right, good question. You see, the point is, first of all, as far as the MRI available to us is 1.5 Tesla, maybe 3 Tesla, which is fairly good. But I was talking of the structural MRI. Structural MRI is totally different. This is not available in India, and to the best of my knowledge, if somebody can add to me. There was a time when I was taught for almost 20 to 30 years that there is no secondary neurogenesis The neurogenesis is possible only in the womb of the mother. And the consciousness comes in the womb of the mother. The personality, the subconscious mind becomes active in the womb of the mother. And that's where the things are formed, as far as the conation is concerned. And whether these things, I'll go a step further. So-called polypill. It is salicylic acid, it is statin, and it's ramipril. Some sort of combination. In which way this is going to, you see, the brain blood flow is anti-gravity. This is not pro-gravity. So anti-gravity brain blood flow in case jeopardized, because most of the time it has been seen by various virtues, primary neuronal dementia isolatedly, purely is rare. It is mostly multi-infarct also. There are small infarct, plus there is a primary neuronal dementia, aging. So in those situations where there is decreased brain blood flow, which is quoted, unquoted is there. Similarly, please do, I am just taking some time. I talked to one of my cardiology friend. I talked about the ischemic cardiomyopathy. What is the last resort? He said. He tried everything. He said, why not to try anticoagulants to increase the flow as far as the cardiac muscles are concerned. In this, I am not talking about the anticoagulants. There are so many types of antiplatelet drugs, dual antiplatelet drugs, and even aspirin and plus some other anticoagulants are also available. But they do have role to play in this.
Right, thank you very much. And as you have already emphasized, talking becomes very important. And so it is rightly said, talk and talk to your patient till the patient gives you the diagnosis. And as far as Brahmi was concerned, I also do advocate Brahmi for greater brain function. Thank you very much.
Thank you.
Nice talk, sir. Yeah, this is also one of the strategy.
Yeah.
Should I come to that in my comment about this response of this question?
Please, sir, please.
Okay. You started with the right and left brain. I have very simple understanding of right and left brain. That our left brain weighs pros and cons. And usually it takes right decisions because it weighs pros and cons. कि risk ज़्यादा है, benefit ज़्यादा है. But our right brain, it is emotional brain. It thinks by heart. So I say right brain is a mini heart, equivalent to mini heart. And it takes big decisions, which may be sometime wrong, but it takes big decisions and never thinks of loss or benefits. Like living example, Dr. Bansal, he is devoting time and everything to this association. He is working through his right brain. So, simple way I think the analogy of these two brains.
I fully agree with you. 90% of our brain is subconscious. I'm not going to talk about the fruit philosophy. I'm not going to talk about the ego and superego. Where does it lie? Whether this lies in the subconscious mind or in the conscious mind. But I will say conscious mind is very small. Of course, the intellect lies over there. It can kickstart the things automatically. Whatsoever I'm speaking now, I am speaking by virtue of my subconscious mind. I am not speaking by virtue of my conscious mind. I started my talk with the conscious mind, but thereafter I'm all subconscious mind. Your point is well taken.
Your right brain is intuitive. So think by your intuition.
Yeah. And at the same time, that's what I said.
One little clinical experience, if I'm allowed to share.
Yeah, please, sir, please.
I usually, whenever any senior citizen comes to my chamber for consultation, I usually, apart from the other these things, I usually ask two questions. That how you spend your time, whole day time, how you schedule your time. That is question one. And question two, at this moment, what is your purpose of life? Because asking these questions gives me a lot of insight about the patient.
Right.
Secondly, it also gives me some positive thing about me, that how I would like to behave when I become old.
Yeah.
I choose the best thing out of those questions. So one of the patient, I remember one of the patient, she answered this purpose of, because purpose of life, most of the people they say purpose of life is just ਹੁਣ ਥੋੜੇ ਦਿਨ ਹੈ ਜੀ ਲੈਂਦੇ ਆ, ਜਿਸ ਤਰ੍ਹਾਂ ਬੱਚੇ ਕਹਿੰਦੇ ਆ ਕਰ ਲਾਂਗੇ. these kind of things, and अब हमें क्या करना है कुछ करके, I have fulfilled my duties. So these are the usual answers, but one answer which struck my brain, I still remember, and that was very atypical kind of answer, but very, very right answer, and I think that we can use that answer in our management of such patients, aging patients. And answer was कि I am preparing myself to meet my goal as early as possible.
Right.
And I want to go there with mentally and physically healthy.
Right.
So in Indian patients, if you add the spiritual content in their mind, I think that is very helpful for this particular age group. So on that day, I wrote 1-2 couplets, if you're allowed, on that patient only, because I like that answer so much. Because most of the old people, they have one fear of any dreadful illness or fear of death. कि पता नहीं कब जान निकल जाए. That fear is there in the mind, consciously or unconsciously. So that lady gave that answer. On that I wrote 2 lines. नहीं, no problem, no. ना कोई मौत का डर, ना गम. ना कोई मौत का डर, ना गम. यह तो सुनहरी मंजिल है ओ सनम. यह अंत नहीं आगाज़ है. यह अंत नहीं आगाज़ है, बेफिक्री का साज है, नई ज़िंदगी का ताज है. उसकी मर्ज़ी से उससे मिलने का एक नज़रिया है, अपना तो जब बस जीने का यही नज़रिया है.
Good. So any question?
sir.
Last one, you asked about the spirituality, right? So spirituality is one of the very important thing. Again, I'm telling you, this is all subconscious mind. Where lies the spirituality? See, I'm not going into detail of this. I'm not talking about the yoga, Ashtanga yoga, or the Patanjali yoga, or Raj yoga, or the first Sam, Dam, Pratyahara, and other things. But what you said, what you are saying, it's all linked with the subconscious mind. You see, we have to open the gateway of the conscious mind so that there is a good flow between the conscious and subconscious mind.
Right,
And
we
I
are
will
constant with time.
Yes.
You wanted to say something, last line.
I just wanted to say, talking to the intrauterine baby is also very important.
I said
The
it.
story of Abhimanyu,
Yeah, I
very
said it.
correct. So I tell my all antenatal patient, talk. Everybody has to talk to the baby.
Right,
Thank you.
so
Let us
thank you
conclude the
very much.
session.
That comes to the end of this session. Thank you, my co-chair, and
Well, friends, I just want to add one thing here about Suresh Bansal. You know, you can continue talking to him on brain for days together, but it never end. You can see how much he's involved in the whole thing. He's written a book on the mind, because not only brain, I think he knows much more about the mind than the brain. So if you are interested, book is available on the store and you can jolly well have it. Thank you.